All right, we're going to move straight into the speaker program now. Our first speaker today comes from Canada and joins us via Zoom. I'd like to welcome Associate Professor Lynda Balneaves from the College of Nursing Radi Faculty at Health Sciences at the University of Manitoba, Canada. Lynda's research program for the last 25 years has focused on the complementary therapies in the context of cancer. Lynda's topic today is medicinal cannabis and the nurse, opportunities and challenges. Ladies and gentlemen, please welcome Lynda.
Hello, everyone, and I really wish I was joining you in person. However, I am teaching a graduate nursing program for the first time in 2 years in person, and I just wasn't able to fit this into my schedule. But thank you so much for this invitation. I'm really excited to hear what you're all doing in Australia. In many ways, Brett, Sally-Ann, and Kate gave a good Coles note of where I hope to head in this presentation, of where I see nurses advancing this field, what the opportunities are for us as a profession, including the midwives, but what are the challenges? And I'm speaking from Canada that has a lengthy history with medical cannabis, and hopefully there are some lessons that you can learn and hopefully overcome much faster than we did here in our country. I do want to acknowledge that I'm speaking to you from the University of Manitoba, which is on the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene people, as well as the homeland of the Métis. We respect the treaties that were made on these territories, and we acknowledge the harms and the mistakes of the past. As a university, we are dedicated to moving forward in partnership with the Indigenous communities in Canada and in Manitoba, in the spirit of reconciliation, as well as collaboration. To start, I just want to make a few disclosures, being that I really have no disclosures. In Canada, there are some real barriers for us partnering with the cannabis industry. It is strongly discouraged by our national funding bodies because of the engagement of cannabis with the tobacco as well as the alcohol industry, which has made research very challenging in our country, and I'll be touching on later on. So I have no support from the cannabis industry, and the only disclosure I have is that I am Deputy Director of the Canadian Consortium for the Investigation of Cannabinoids, which is a nonprofit organization in Canada that's devoted to advancing education as well as research on all things cannabis. In terms of just an outline of where we're going to head, hopefully in the next 40 or some minutes, I'm going to just give you a really brief overview of just cannabis policy in Canada, because I think it sets the stage to talk about where nurses and midwives fit in this quite complicated healthcare system that is medical cannabis in Canada. I'm also going to talk a little bit about the implications of medical cannabis for us as a profession, focusing on practice, education, which has already been mentioned, research, as well as policy and advocacy. And then just kind of wrapping things up with looking towards the future and hoping to have some dialogue about where you see yourselves headed in Australia. So let's talk about policy. It is most definitely a work in progress. So some of you may know this history and some may not. Medical cannabis in Canada has been legal since 2001. And there has been numerous revisions to that program. We started off growing medical cannabis in a mine in Flin Flon, Manitoba. And that was the only source of our medical cannabis. It was irradiated to the end of its life. It was dried out and almost was dust. And that was what was offered to patients, which was completely unacceptable. And over the past 20 years, that program has evolved to the point where we now have almost 100 legal producers and distributors of medical cannabis in this country, as well as recreational cannabis, which we'll touch on. But there's been numerous challenges that's really kind of pushed our medical cannabis program to expand the type of cannabis products that are available, the amounts that people can have, and those legal challenges are still occurring. Most notably right now in my own province, of people's ability to grow their own medicine within their home, in their backyard, which has been restricted by certain jurisdictions in our country. In 2018, though, non-medical cannabis was legalized federally in Canada through our Cannabis Act. And our medical cannabis program and policies were subsumed under those acts as well as the regulations attached to it. And to be honest, the legalization of recreational cannabis has really challenged us in the medical cannabis realm. A lot of the focus has turned towards the impact of legalizing that medical cannabis, and we've lost a bit of the focus on medical cannabis, including research as well as product development. And again, I will touch on that a little bit further. Very briefly, the Cannabis Act federally means that if you are over the age of if you're 18 or older, you are allowed to use cannabis for recreational purposes. You can have 30 grams of dried cannabis product in public. You can grow it at home in certain jurisdictions, but it varies across the country. And again, I live in an area where no home grow is allowed. And there's very similar restrictions on how it's advertised in Canada, very similar to the way tobacco is framed. And there's really stiff penalties for anyone that engages youth in recreational cannabis in terms of selling or distributing, or having advertisement that's geared towards youth and young adults. And there's been a real focus in creating the Cannabis Act on public education about risks and problematic use. And as you can imagine, this legislation, these types of regulations, has really shifted the focus away from the potential therapeutic benefit of cannabis to really kind of double down and focus on the problems or the risks associated with cannabis. And it hasn't really helped us in furthering that dialogue around what could be the potential medical benefits and how do we implement that into our healthcare system. But that being said, the focus of our program has really been about minimizing harm to at-risk populations and to not focus on this being an industry of profit, but really focusing on it from a public health lens. In terms of where you can access medical cannabis from, as I mentioned, personal production, or you could designate someone to grow, particularly if you're unable to physically to grow, or you're living in an arrangement where that's not possible. And again, that can vary, and there's some jurisdictions that are kind of fighting us on the ability to produce your own medicine. And most people then are going through the licensed producers, which are federally regulated and approved. You can have a 30-day supply of cannabis, and I'm speaking the 150 grams from the perspective of dried cannabis or equivalent, if you're using something like an oil. And you can have then the 30 grams of recreational on top of that. If you're stopped by law enforcement, you do have to show your registration if you're using it in a context where recreational cannabis is not allowed. For example, if you're using it at school, if you're using it in a playground, you would have to show your medical registration. And you can store as much as you want at home. In terms of how people are able to access medical cannabis, you need to have a conversation with a doctor or a nurse practitioner who signs an authorization form. It's not a prescription, it's considered an authorization. And nurse practitioners have been at the table since day one, which is actually quite fascinating for me because there wasn't a lot of dialogue with the nursing profession when those legislations were made back in 2001. But we've always been at the table, but it doesn't mean that we've really made any advances in terms of embedding education within our nurse practitioner programs or even our undergrad programs to support nurses in that role. A patient or a family member, for example, a parent or guardian, will then need to register that authorization with a licensed producer. And they're now allowed to split dosages or types of products across different licensed producers because they're all quite unique. You then have to order your cannabis product from that LP or licensed producer. And sometimes the authorization is very specific in terms of the species or cultivar of cannabis, how much THC and CBD, the ratio that's being authorized, and the type of cannabis product that should be used. It's then delivered by courier to a person's residence. And in terms of people, if they're in a long-term care setting, or if they're in a hospital or some other healthcare setting, it really varies across institutions. And we see that as a real barrier sometimes where an institution hasn't really followed up in creating their own policies and creating their own processes so that patients and clients and families can actually access it if someone is living in those facilities or receiving care. So a bit problematic. Just some other things to mention. Medical cannabis doesn't have a DIN number, a drug identification number. And as a consequence, people really struggle to get it covered as a medicine. There are some third-party health insurers in Canada that do cover it, and some people can claim it on their tax return. And some licensed producers offer compassionate pricing for individuals that are really struggling with the cost of medical cannabis, which is a significant issue, which I will again touch on a bit later. For children, for individuals under the age of 18, for people that may not be able to consent, they have cognitive impairment, a parent, guardian, or caregiver can possess cannabis for that individual. And if you are caring for someone that's an adult, you are able to possess it and also help in distributing it so that person can have access to their medicine. And these are some real regulations that have advanced over the years because of the advocacy of patients and also healthcare providers such as nurses to really say this program has to work for people. We can't have barriers to people accessing what many see as a medicine that gives them life and helps them survive. What's really interesting is that 2-3 years ago, before legalization of non-medical cannabis, we saw about 350,000, I think we topped off at around 360,000 Canadians that were registered as part of the medical cannabis program. Most people were doing that for pain or for mental health conditions such as anxiety or depression, and that hasn't really changed much. What's changed, though, is that we're starting to see a very dramatic drop in the number of Canadians that are registered. We're just over 290,000 now. So the question in our minds is where did these 50,000 people go? And what's even more intriguing is that with legalization, we started a national annual survey called the Canadian Cannabis Survey. And through those surveys, what's been revealed is that over 1 million Canadians are framing their cannabis use from a therapeutic perspective. So why do we have such a gap between people that are registered in the program and people that are actually using cannabis for a medical purpose or a health purpose of some sort? And what's really coming out through research that we've done in the past, as well as research that we're currently doing now, is that there's a whole lot of barriers that are still existing for people accessing medical cannabis in Canada. That includes our healthcare providers, including nurses and midwives, having a lack of knowledge regarding medical cannabis, the endocannabinoid system, and how to actually incorporate this as part of our practice. And as a consequence of having limited evidence, we don't have any clinical practice guidelines, which many people are reliant on to help direct their practice. And there's also some valid concerns about the side effects of cannabis and whether we have to be conscious of things like dependency. From a patient perspective, not surprisingly, they really struggle to find a healthcare provider, a physician or a nurse practitioner that's willing to actually support their use and sign that authorization form. Cost is a huge issue. Over and over again, patients and families are telling us that you're taxing my medicine. There is the same tax on recreational cannabis in Canada as there is now on medical cannabis. It is often unaffordable for many individuals. We have restrictions around things like how much THC can be in an edible. People have to use such a large quantity of edibles, they're unable to afford it, and they're forced to look elsewhere in terms of accessing those edibles. And there's some real barriers. People that live in social housing have a whole lot of rules about you can't consume cannabis on this presence. I don't care if it's medical or not. There's no way you're allowed to grow it in that setting. And if you live in rural and remote communities, that access can be really problematic. I had one woman say, everyone knows the postmistress in our community, and she knows everyone that's using cannabis in this community because she's the one that's distributing the packages. And that was a real barrier for them in terms of accessing it through the federal program. And there's still stigma. We've been doing this for over 20 years, and I still get doctors that say to me, they just want to get high. They're just looking for a cheap source, which It's not cheap. And so there's a lot of stigma that's still attached to using cannabis, even though it's now legal for recreational purposes. And those barriers to access are even worse for people that are in a marginalized group or living in remote and rural locations. So as a consequence, it's not surprising people are still growing it at home, but obtaining their seeds through the illicit, illegal market. We see people that are still relying on their street source or their dealers because they're able to get it in a less expensive manner. They're able to get products that aren't available through the legal system that perhaps better meet their medical needs. But there's obviously some risks attached to accessing it through an unregulated source. We also see people, and some of this has been worsened since legalization, is they get very confused of what's legal and what's not legal, especially on the internet. And so people are purchasing through illegal sources on the internet, either through Canada or through the United States. And then lastly, and I think most significantly, is that people are saying, why in the world would I try to book an appointment, experience stigma, wait for an authorization, wait for me to register, wait for my courier, get told the product's not available, when I can walk down the block and walk into the recreational store and purchase my product there. And so I think that's where the real exodus of Canadians from the medical cannabis program are headed, is down the street to our recreational stores, which obviously raises some concerns about, are they getting appropriate consultation, decision support, follow-up, and then for people that are underage, for people that perhaps need documentation for health insurance, income tax, for work exemptions, they really miss out and are kind of left in the dark. So what does this mean for us as nurses, and obviously also as midwives? And number one is, there has to be a shift in our practice. The research around the world is growing around the potential role of cannabis, the endocannabinoid system, in a multitude of health conditions and symptom managements. And so one of the first roles I see is that we have to be providing education to our clients and to our communities about cannabis. We also need to address problematic use. I think it's very important that nurses come at medical cannabis, not saying it's a benign substance. It's not a benign substance. It actually has health effects, but it also could have potentially health effects that are negative for some individuals or in certain circumstances. And I think we need to have that balanced approach. Obviously, I strongly believe that nurses have the capacity, nurse practitioners, those in advanced practice, midwives potentially, of actually prescribing and or authorizing medical cannabis use and providing that essential follow-up care. And then lastly, I think we all, as point of care nurses, midwives, would have a role in helping and administering medical cannabis. Now, talking a little bit about education about cannabis, I'm not going to get into great details because I'm sure there's other presentations that are going to address this. But I do want to point out that a lot of the risks that people are concerned about with cannabis is really coming from literature that's focused on recreational use of cannabis, high dose THC, daily use. And some of those situations don't really apply to medical cannabis patients, particularly if they're doing something like microdosing, where they're using very low levels of THC, or perhaps they're not using any THC and they're much more focused on CBD instead, which doesn't have that psychoactive effect that we traditionally associate with THC. So I just want to kind of put that out there that, some of these risks will not apply to all medical cannabis patients. But we do need to acknowledge that for some individuals, particularly those that may have already standing issues around their heart health, their respiratory system, we can sometimes see high levels of THC causing some negative impact. We do, especially in the older adult, we can see people that can experience hypotension, they can feel very dizzy, and there has been some concern that there's a link for people that have cardiac disease, that it could lead to things like stroke or heart attack. And that's why it's so important that we have those conversations with our patients and look at their full health history when we're advising them about whether cannabis is appropriate. We also, and I've had this experience with an oncology patient, she was using medical cannabis. It was very effective in managing some of the symptoms of her conventional cancer treatment. And then she couldn't stop throwing up. And she was using enough cannabis and in a chronic way that she actually developed hyperemesis syndrome. And she just thought that perhaps her cancer was advancing or she was having a sensitivity to her chemotherapy, when in fact, we were able to work backwards, that it was actually her use of high dose THC cannabis. So something that we do need to be aware of and advise patients on. We all know that cannabis can affect cognitive functioning. There's a lot of fMRI studies that are going on right now, which I think are really going to help us tease this out even further. But it can affect people's memories. It can, affect their executive functioning. It can affect their coordination, which can have implications, especially for people that are, driving, working with machinery, working with children. These are all things that people need to be aware of, and perhaps, use certain types of cannabis products when they're going to bed versus using certain ones during the day when they may be at work or going to school. Mental health is a concern, particularly again for people that have pre-existing mental health issues such as schizophrenia or some form of psychosis. We have seen individuals that are using high dosages of THC cannabis products can have psychotic episodes. We do see perhaps an earlier onset of schizophrenia in some individuals, again, focusing on those high THC products. And we're still unpacking anxiety and depression. And I think it's going to be really important that we tease out the effect of THC versus CBD in terms of people's mental health and whether it can exacerbate it, improve it, and if we could potentially have kind of a bimodal effect where a little bit is good, too much, is not so great. And then lastly, I don't use the word addiction, and I know people debate me on this. I see not really the classic presentation of addiction with cannabis, but there is definitely a dependency that occurs, and people can have mild withdrawal symptoms attached to it, as well as mental health kind of withdrawal symptoms as well, anxiety, inability to sleep, etc. It only occurs in 9% of cannabis consumers, and I really would like to see some research on medical cannabis patients to see if that stat still holds or if it perhaps is quite different than compared to people that are using it for recreational purposes. I'm conscious of time, so I might start talking a little bit faster here. But in terms of providing education about cannabis, we obviously also want to balance, I call it the no part of the presentation with the yes part of the presentation, or perhaps this will be helpful. And we have a lot of research. Many of it has been focused on nabilone, marinol, and other kind of pharmaceutical forms of cannabinoids, that there does seem to be a role of the endocannabinoid system and our cannabinoids in managing pain. And we're still doing a lot of research on that in terms of unpacking acute, chronic neuropathic pain. What is the actual mechanism of action? But there is some suggestion, both, through some RCTs, not as many as we need, but also from patients' experiences, that it may be helpful in managing certain types of pain, and it, more importantly, may be helpful in reducing their use of pharmaceuticals, some that can be quite dangerous, for example, opioids. So much more research needs to be done on this. I think most of you probably know that there is a really strong indication that CBD helps in managing seizures. And we actually see in the United States, Epidiolex, which is a pharmaceutical form of CBD, actually now being authorized and used in managing Dravet syndrome, which is pediatric epilepsy, where people have hundreds of seizures a day. There is also in Canada, there is authorization approved for chemotherapy-induced nausea and vomiting. And I was very fortunate to be part of a guideline that was developed around palliative care, not only dealing with some of the symptoms that occur at end of life, but also addressing some of the existential crises that people may experience at end of life, as well as enhancing their senses around music, art appreciation, food, enjoyment of conversations. I think we often discount the role of cannabis in those dealing with those existential issues and improving people's quality of life at end of life. And what I think is amazing in the United States, and I wish we saw more of it here in Canada, and I think we're headed there, and I'm sure Australia will follow very, very shortly if you haven't already, is we're creating this new role called the cannabis nurse. And we see this role, happening in private practice, but it's also embedded in some dispensaries, in some hospitals. But in Canada, we're mainly seeing them in medical cannabis clinics. And these are often used by individuals that are really struggling with their specialist or their general practitioner or their nurse practitioner to get that authorization. They're able to self-refer into these medical cannabis clinics, and often they will have a nurse assigned to them that is well versed in the endocannabinoid system, knows the ins and outs of titrating medical cannabis and monitoring outcomes. And they really are kind of a touch point for individuals that are, naive to medical cannabis and really need that kind of navigation to understand it. And we also see some industry also have that nurse role to heavily help in patient advisement. It's really important though that you check, whether that's an approved role in your region, talk to your legal body, your regulatory body, what your scope of practice would be, especially if you're in private practice, and what products are legal in your region. And you just want to make sure that you're doing everything above board, you're keeping careful notes and documentation, and that you have the training and the education to take on such a role. But I think I see such innovation for nursing and midwives in this space, because not all physicians are comfortable, pharmacists aren't too sure. Nurses have such an intimate relationship with clients and families. I think we're very well positioned to move forward. There's also this, idea of addressing problematic cannabis use. And I don't want to belabor this point, but we are, again, really well situated to talk about harm reduction, not no, don't use that, but really talk about, what are you using for cannabis? Distinguishing, okay, what's your non-medical use? Are you using it also for medical? Tell me about how you're using medical cannabis. Are you concerned at all about how cannabis use is impacting you, your family, your relationships, your goals in life? And I'm sure all of you have had training in this, but it's really about avoiding stigma, respecting the individual and their decision and making sure that they're accepting responsibility and having that balanced message. And we actually in Canada have the Canada's lower risk cannabis use guidelines. It was just updated. And it's really a common sense guideline about avoiding high potency THC products unless they're indicated. Don't drive, don't operate machinery. If you have some health conditions that could be contraindicated, talk to a health professional about it, and don't use unfamiliar, unregulated products. But it's a nice guideline to follow when you're having that conversation with clients and families. And now into the really fun stuff about authorizing medical cannabis. As I mentioned, in Canada, NPs are allowed to do that. And through my research, I found that Australia also allows their advanced practice nurses to do that as well. And I think there's going to be some follow-up talking a little bit more about those regulations. So I'm not going to get into that for you guys because I don't want to misspeak. But in Canada, the NPs are only allowed to approve medical cannabis if they're a client actually under your care and they require it, which is quite an ambiguous term. But they really want you to have an authentic relationship with that client, that you actually know their history, you know their medications, you know what they've tried in the past, so that you can really provide an appropriate consultation around medical cannabis. And obviously you need the training and the skills, which we will talk a little bit about can be problematic. But for those that are interested, especially for any decision makers or regulators in the room, we do have a practice direction in my own province around authorization. And this is where a lot of nurses and probably midwives as well get a little bit antsy. It's like, oh my God, my client's using this. I'm providing home care, or I'm in a clinical setting, and I really don't know what I'm allowed to do and what I'm not allowed to do. In Canada, we are allowed either to directly or indirectly administer medical cannabis. And this is across all healthcare settings, including home care. And in terms of indirect administration, we can open bottles or packaging. Trying to open an edible package, I can't even do it. Imagine if you're living with osteoarthritis, how hard it would be. Reading labels, making sure they're using it at the right time, and providing foods and fluids to help someone self-administer. It really varies across institutions and clinicians, their comfort level of directly administering it. But I'm currently doing a study right now in a long-term care rehab setting where we have individuals, with spinal injuries, and they're not able to actually consume their cannabis for spasms, for pain management. And so they directly need assistance in either, holding a vape pen to their mouth or actually consuming an oil gel, for example. And when I talk about administration and also authorization, like, it's all about your competency and authority. In Canada, you have to ensure that your client has the appropriate documentation, has that authorization in hand, that they're not using illegal substances, that their medical cannabis is actually coming from an LP, has the appropriate labeling on it. And if you're in a healthcare setting, they need that written medical order. And you also have to think about things, for those of you that might be nurse managers, you need to think about, how are we going to store medical cannabis? How are we going to dispose of it after it's been consumed? And if people are consuming it and they're trying to do through an inhaled route, how does that conflict with institutional policies around particularly tobacco products and inhaling, vaping, and just worker compensation policies as well, in terms of exposing others potentially to byproducts of cannabis. Education. And thank you so much for your opening and just that rallying cry. I one time did a presentation and I didn't realize my dean was in the audience, and I was presenting about the need for education around cannabis in our nursing program. And I said, I had an undergrad come to me and said that they wanted to know more. And I said, well, what have you learned to date? And they said, cannabis doesn't cure glaucoma. And I said, 1970 called and it wants its curriculum back. We have gone so far beyond cannabis and glaucoma, and it was shocking that there had been no conversation beyond that about the potential role of cannabis, and the focus was primarily on problematic use. And so I strongly believe that we need to have content of both medical and non-medical cannabis in all levels of our nursing and midwifery training. And for those that are already practicing, we need to be developing continuing education courses. And it's shocking to me. I say this is one of the biggest policy changes in our country. And how can we not be addressing it as the most, the largest health profession in our country? And I think we really need to start pushing for certification of cannabis nursing as a specialty. And I know that organizations like the American Cannabis Nurses Association is working very hard with the ANA in America to try to get that certification, because I think that not only legally protects us, but it ensures that people aren't putting out that shingle and aren't prepared to walk the talk of a cannabis nurse. And, my research for the last couple of years has been really focused on this issue of what is going on in nursing. Why are we not addressing this? Why do I present to leadership committees and say, we need to talk about this, and they all nod and then nothing happens? And so we did a national needs assessment of our nurse practitioners. And what really came out is just a lack of knowledge, particularly around dosing and creating effective treatment plans, around how medical cannabis is structured in Canada, but also about just, there's a lot of different types of cannabis products. How do they sort this all out? Prescription, non-prescription, how does this work? As well as, understanding the endocannabinoid system in general. We then followed that up with a study that was a mixed method study called Guarding Their Practice, which was really focused on understanding what was in the nurse practitioner programs and what were the real barriers, and creating these gaps in knowledge. And what really kind of came out to us is that there's a lack of expertise. How can you teach if you don't know it yourself? So our faculty need that training desperately. The perception that there's a lack of evidence around medical cannabis. For some conditions, perhaps, but perhaps not for others. And that they even perceived it as not being part of an advanced practice nurse's scope of practice, which is problematic when our own regulatory body says it is. And what was really concerning is that only 60% of our programs in Canada actually have any content on medical cannabis. And they don't even talk really about dosing, only a handful really do. But at the same time, all of them suggest that we should be authorizing it. So there's a bit of disjuncture there that we need to address very rapidly. But things are getting better. The American Cannabis Nurses Association has online education. In Canada, we have McMaster University that has a program. The Canadian Cannabis Syllabus, which I was part of, was developed particularly for NPs and for MDs. It's available online. I've got a slide at the end. And we also are seeing other organizations step forward to really try to advance education and ensure that nurses are able to converse about this and provide appropriate care. You know, and I'm a researcher. I love research. It's been mainly the focus of my career since I graduated. And I really want to encourage anyone that has that leaning in the audience. Nurses can be leading research in this area. I literally just got off the phone from a major funder who says, we want to interview you because we're wanting you to perhaps lead a clinical trial program on cannabis and cancer in Canada. Don't know if it's going to happen, but you know, I have written a team grant around it. We were one away from funding. Maybe this is a chance for us to have a nurse-led clinical trial program that's going to really advance into management with medical cannabis in our cancer community. So don't think that as a nurse, you can't be leading those projects. And I also think on the other side, we also can be helping out for people that have problematic use and how do we get harm reduction interventions out there. I also think that we need to be not only educating our nurses and training them, but we also need to be evaluating that education and training to make sure that it's actually being taken up, or are they experiencing barriers to actually implementing that knowledge in the clinical setting, structural, systemic barriers that we're going to need to work on and do some advocacy around. And as that knowledge develops, we need to be developing those clinical practice guidelines. I think we all know how powerful they are within the nursing and midwifery professions, how they change care, how they get taken up in clinical settings. So we need to be focusing on innovative knowledge translation and exchange projects. As we see more and more countries around the world consider legalizing non-medical cannabis, we have a role in also understanding the health and social impacts of that, as well as what's the impact of decriminalizing non-medical cannabis, because the harms of criminalization were pretty bad in Canada and mainly targeted marginalized groups, particularly our Indigenous community. And then lastly, health services research. If we're going to change policymakers' minds and our healthcare funders, we have to do health services research alongside our medical cannabis research to show that it's changing how people are using the healthcare system. It's reducing the use of very expensive pharmaceuticals, hopefully. We need to understand that impact from that health services and economics perspective. So that's just my shout out. There's tons of more. If you're looking for a research area and you're at the beginning of your career, the world is your oyster. I don't have a lot of time. I'm watching the clock here. I'm leading a national survey right now called the MCAS survey. And this is really focused on providing Canadians that are using medical cannabis, both legally and illegally, with a voice. Health Canada has determined that we need a review of the program that will occur later this year. And they basically said, we're not sure how we're going to consult Canadians. So we took it upon ourselves, as well, a very multidisciplinary team, including patient advocates, to ensure that a survey was done. And I think we're around 3,500 Canadians right now, and they're telling us it's too expensive, it's too hard to get, it's easier to go through my recreational system, and the products are not as diverse and meeting my medical needs. And please do more research. So that's the Coles notes of what is a very expansive survey. But there's a ton of barriers. And again, I can't go into all of them, but with the legalization of recreational cannabis in Canada, a lot of the funding has focused on the social and health harms of cannabis. And we kind of lost track that, hey, we're also over here doing our medical cannabis stuff. We've had one major team grant for $13 million that was funded that was supposed to look at a whole host of health conditions and the potential role of medical cannabis. We had a workshop 6 months ago to talk about how people are doing with their team grants. Not a single trial had been launched because no one could get through the regulatory process to gain access to the product. the product that they could have walked down the street and bought over lunch hour. So Health Canada has recognized this as a concern. They're working with certain licensed producers to develop medical grade product. They're also recognizing and struggling with the notion that we can't have PK and PD data, pharmacokinetic, pharmacodynamic data, the same way you would have for a drug trial, as you would with a plant product such as cannabis. That research takes years, it's incredibly expensive, industry's not interested in funding it. To have that as the bar that we have to hit before we can do our clinical trials will mean Canada will never be part and be a leader in research in medical cannabis. And there's just a lot of barriers I mentioned at the very beginning. I can't even access product from an industry partner. I have to pay for it, which increases the expense of my grants, and we have very limited funding envelopes in Canada. And it seems ridiculous when at the same time I can be part of a cancer clinical trial and the pharmaceutical product is provided with no problem. So we need to sort that out, because you can't do this type of high quality research without having industry as a partner. And I hope Canada is going to move forward and recognize this as a barrier, and we can have that full partnership. And so just to kind of wrap up here as we're moving to the end here, you know, we have to address the structural and systemic issues that surround medical cannabis and nurses having a role. And so again, it was great to hear that people were talking about that advocacy role. We need to be a vocal voice about having policies, you know, that aren't stigmatizing, you know, that don't solely focus on recreational cannabis, but also focus on the medical cannabis. And nurses are key. And I've been very fortunate to work with the Canadian Nursing Association and to go to our House of Commons, to go to our Senate hearings and speak from my research and from the perspective of Canadians that have been part of my research and as a nurse. And let me tell you, trying to present against, the Canadian Medical Association that has a very different perspective has been very interesting. But people trust nurses, and they do trust our perspective and our voice. You know, we also need to ensure that we have supportive policies not only in our regulatory bodies, but in our institutions, so that nurses can authorize medical cannabis and also be able to indirectly or directly administer it. There's no point in having all these policies and scopes of practices, and then you go into a healthcare setting and they're like, no, we're not going to allow you to do that. And then lastly, we have to consider that we do have cannabis now that's being used by nurses and nursing students. So we can't bury our head in the sand about that. And we have to address that notion of fitness to practice and fitness to learn. And how do we do this in a way that isn't stigmatizing, respects autonomy, but also ensures the safety of our students, our nurses, and the clients that they are caring for. And, you know, we are moving forward in that. And, you know, I looked through the web and we're seeing these statements come out, including your Australian Nursing and Midwifery Federation, which is wonderful to see. And I've already touched on this notion of fitness to practice and fitness to learn. You know, we are in a safety sensitive role. We have to be cognizant of impairment, be it medical cannabis, be it T3s, be it benzodiazepine. You know, if you're using a substance, we need to be considering how it's impacting the care that we're providing, but it's a challenge. And if you're a medical cannabis consumer, your notion of impairment, how cannabis affects you may be very different than someone that's using it naively or recreationally. And so we need nuanced policies around this that are respectful, but also protect our clients. So just looking to the future, wrapping up really quickly, because I've got 3 seconds left. You know, this is a budding issue. I had to throw one pun in there. There's a growing number of clients, nursing colleagues, students, that are interested in or using medical and non-medical cannabis. It's everywhere. You know, people I never thought would be interested in cannabis are asking me questions about cannabis. We as nurses need to be able to talk about it. We need to have that knowledge to empower ourselves and our profession, but also our clients and their families. You know, we need to be addressing this through our practice, through our education, through our research and our advocacy about the potential of medical cannabis, and also the potential harms. We want to have that balanced approach. And as cannabis and its position shifts in our society, we have to be nimble. We have to shift our practice, our education, our policies as well, and recognize that it's not going to be a one and done. This is going to be emerging evidence over the next 50 years. We are going to need to be rapidly changing our education and our practice as that emerges. So there's going to be a lot of challenges, but I think there's going to be a wealth of opportunities as well. And I look forward to hearing what opportunities you see for yourselves. So thank you so much. Always happy to hear from folks. And I'll just leave on the slide if people are interested in what we're developing here in Canada for point of care education for our healthcare providers. So thanks so much. I look forward to your questions and comments.
Thank you so much, Lynda. That was absolutely wonderful, and you had a very engaged room over here, so really appreciate it.
Thank you.
Wonderful. We look forward to seeing you in person one day too. I think she got cut off, but I'm sure she's very engaging. She's just absolutely lovely, and so many incredible points in there as well. Pretty amazing to see, I think, the powerful connections and points that she's making across the two countries.